This part of the audio lecture is going to address stretching, flexibility, and range of motion. Flexibility and range of motion are two terms that some people use synonymously. However, they both have distinct definitions. Flexibility is a musculotendinous unit's ability to elongate with application of a stretching force. Conversely, range of motion is the amount of mobility of a joint. It's determined by the soft tissue and bony structures in the area. One thing to remember is that flexibility is joint specific. There's also no valid test of general flexibility. When it comes to measuring flexibility and range of motion, there are both laboratory methods and field methods. Some examples of laboratory methods include goniometry, visual estimation, radiography, photography, linear measurements, and trigonometry. When it comes to laboratory methods, the most reliable and valid method of measurement for range of motion is radiography. However, this has limited feasibility. The radiographic images that are usually obtained are x-rays. Every time we want to measure somebody's range of motion, we can't give them an x-ray. One, from a equipment standpoint, that's unrealistic in a lot of settings. We don't want to expose the patient to that much radiation, and the cost is exorbitant. A different method that we could use that still has reliable data is goniometry. Pictured here is a goniometer. This is used to measure up specific landmarks and have the patient either go through the range of motion actively or passively, and then a measure is obtained. Goniometry can be reliable and valid as long as proper test procedures are followed. Can you think of an instance where reliability or validity might be impacted? One example would be if we're measuring the shoulder range of motion. Whenever we measure range of motion, we want to be in anatomical position. As you all remember from anatomy, anatomical position is standing with our palms facing forward. That's not everybody's default positioning for just everyday life. However, if we wanted to obtain an internal or external rotation measurement of the shoulder, if the palms are facing back or towards the body, it might impact our validity or reliability of our measurement because we didn't start in the correct initial testing position. Some examples of field methods for measuring flexibility include the trunk flexion test or trunk extension test. The trunk flexion test is also our sit and reach test. These clinical tests should serve as criterion measures for validity studies of field tests of flexibility for health-related fitness, meaning our laboratory methods or our clinical methods should give us our criterion measures in order to be applied to field tests when assessing flexibility for health-related fitness. One of the most popular field tests to measure flexibility is the trunk flexion test, or the sit and reach test. The sit and reach test was designed to measure flexibility of the lower back and hamstring. Why do we care about trunk flexion? And why do we care about flexibility of the lower back and hamstring? It's thought that the flexibility of the lower back could be related to lower back pain, which will impact 8 out of 10 people in the U.S. sometime in their life. However, when we look at the data for the sit and reach test, it is a valid measure of hamstring flexibility and it's highly reliable. However, it is a poor measure of lower back flexibility and has a poor correlation. It's probably not a valid test for lower back flexibility. And there's no data that links to lower back flexibility and lower back pain. Even with this knowledge, the sit and reach test is still prevalent in tests, including the YMCA adult fitness test. Whether or not the data supports the continual use of the sit and reach is highly debated. Like the trunk flexion test, the trunk extension test is also used in some of our fitness tests. However, the trunk extension test is not common in our health-related fitness tests, but does appear in some of our performance-related fitness tests. There is little research on the validity of this field test, and there's also no reliability or validity measures for trunk extension. In order to determine the reliability and validity of this, additional research would need to be completed. When it comes to range of motion and flexibility, it's important to understand how connective tissue responds to being immobilized. Immobilization can have an effect on all tissue, including bone, muscle, tendon, and skin, just to name a few. Immobilization can be things like bracing or casting or other physiological immobilization techniques can occur within the body itself. When we are examining connective tissue, we know that it's continually replaced and reorganized throughout the body. During this normal process, our connective tissue tends to shorten. However, normal activities of daily living, also referred to as ADLs, can help us overcome this shortening tendency of our tissue. This allows normal motion to be preserved. However, if motion is restricted, rapid changes can occur. Restricted motion can contribute to functional deficits and decreased quality of life. It can also increase our risk of osteoporosis. After periods of immobilization, we transition to this remobilization phase. There are several benefits to early remobilization of tissue when it's appropriate. Immobilization causes collagen to be misaligned during its development, and this leads to decreased tensile strength. However, remobilization can improve collagen's alignment and thus improves its strength. In order to improve flexibility, it's important for us to understand the concept of stress strain. So, in order to change the length of a connective tissue, a load is required, and this load is directly related to the tissue's strength. When we're talking about stress, that's defined as a force that changes the form or shape of a body. Strain is the amount of deformation a structure undergoes when stress is applied. In order to improve flexibility, a force needs to be applied to the tissue, but there is such a thing as too much stress. If that happens, that's when we can get things like tissue rupturing. So it's a delicate balance that we need to apply a load that is high enough to change the connective tissue, but not so high that we cause damage. So while we know stretching tissue is important, the stretching research is not very conclusive on what form of stretching is most appropriate. It's highly debated if static versus dynamic versus PNF stretching is the best form of stretching. In the research, all three forms have shown increased gains when examining pre-test to post-test when some sort of stretching intervention is included. Comparison studies have shown no significant difference between static and dynamic stretching or static and PNF stretching. However, when compared, all three show increased gains in flexibility without significant differences between the results. So we know that stretching works. We just don't know if there's an optimal stretching technique. However, a lot of our stretching or flexibility research is done on healthy gastrocnemius medialis muscles or hamstring muscles. There's not great methodology across the research studies, so it is hard to compare one study to another.